Hello, it's Dr. Rhonda Johnson. Today's Friday, July 14th, 2023. And today I'm talking about Japan's COVID-19 outbreak. You know, in May of this year, on May 8th, the Japanese government downgraded COVID-19 to the same category as seasonal influenza. Specifically, they reclassified COVID-19 as a Class 5 disease, which ended their state of emergency and meant that an emergency will no longer be issued if a resurgence of infection occurred. Well, the SARS-CoV-2 virus does not obey any government declarations. And for the week through July 9th, the number of COVID cases was 3.48 times more than for the week when they did the downgrading. Sadly, Japan is experiencing their 14th straight week of an increase in COVID infections. Japan's health ministry says coronavirus infections are rising nationwide, with some regions seeing larger outbreaks. Now, right now, Okinawa is seeing the greatest increase. The Japanese health ministry said the situation in Okinawa is serious. There's apparently a huge increase in hospitalizations, many in young people under 20 years of age, and they also have other respiratory viruses that are fueling the increase in pediatric hospitalizations, such as RSV. Now, according to an online news source, there's almost no COVID-19 genomic sequencing being done in Okinawa, so it's unclear which of the variants are fueling the ongoing wave. But as of June, the dominant variants in Japan as a whole were Omicron XBB, XBB 1.5, and XBB 1.16, which accounted for over 87% of their cases. Now, to the people of Japan, I hope that your outbreak quickly subsides. We must always remind ourselves that as much as we want COVID to be a thing in the past, COVID is not over. Human behavior can play a major role in fueling this virus, and it can play a major role in spreading and slowing the spread of this virus. Remember those 3 W's that we heard often during the early phase of the pandemic? Wear a mask, wash your hands, and watch your distance. Don't forget about another W, the windows. Open the windows and use a HEPA filter to clean the indoor air. And I hope that you have ample access to Paxlovid for eligible citizens in Japan. Why am I talking about Japan? Because we know that this has been a global pandemic. What happens in one part of the world can happen anywhere in the world, and we're just one plane ride away from any outbreak anywhere in the world. So that's my message today. No matter where you are in this world, I hope that you will be safe and be well, and take care, folks.